Do you want to go ahead and start admitting them?
No, I'm going to
Okay.
send a message to the waiting room telling people that we'll be admitting folks in just a minute.
All righty.
Our department has been trying to start things it's after the hour and end 5 4 to give people a little bit more transition time.
Okay. So 5 minutes after and in 5 minutes before. Okay. Let me keep an eye on my time. So I'm gonna need 11:55.
Once I do your intro, I will go off screen just so that it's easier for folks to see the interpreter. Probably. Do you want to go ahead and do we have multiple spotlight on here? Can you spotlight yourself as well?
Oh, are you talking to me or the interpreters?
Ashley, because right now I'm only seeing Alicia.
Okay. If I spotlight myself, will it interfere with the interpreters?
That's what we're testing to see if it's giving us multiple spotlights or not. Okay, we're good.
Okay, so you can see us both.
Yes.
Fantastic.
Anthony in chat, can you tell me if you can still see both Ashley and Alicia?
Yeah, that's what I can see as well. Looks like Anthony gave the thumbs up to being able to see those two.
Okay, because I can't see him right now. Okay. All right. You know what? I'm going to go ahead and let folks in and just welcome them. Not quite at 12:05 because I know you always have a lot to share.
Yeah, I do tend to talk quite a bit.
Just because you're passionate about what you do.
Exactly.
Welcome. Hi, Trish. Welcome, everyone. We're just giving it another minute or so before we get started. Our department is trying to give people Zoom breaks a little bit more. And so we're starting meetings closer to 5 after the hour and then trying to end about 5 minutes before the hour just to allow more transition time. I don't know if we'll have more folks join or not, but we just wanted to respect that effort because everyone gets Zoom fatigue and we are on way too many meetings right now. We will be sharing PowerPoint for most of this. So it may be easier for you if you turn off your camera. And then during question and answers, you can feel free to turn your camera back on. And you can ask those questions audio or video or in the chat, whichever is best for you. And Ashley will be taking questions throughout. I am not seeing anyone else in our waiting room. So we will go ahead and get started. I'm showing 12:05 on my personal phone. Trish, you have a question before we get started?
How can I make sure the interpreter is enlarged on my screen? I'm not seeing it on my Zoom. Like everything's kind of small.
So if you go up to the top right of your screen, there's a view and you can click on view. And then if you pick side by side speaker, you should see both Ashley, who will be presenting in English, and Alicia, who's presenting, who's one of our interpreters? All right, you're good. Excellent. If you have technical questions, I will try to answer them, and I will make up things that I don't know how to answer, but we will try to figure this out together because everyone's probably using a different kind of device, and it's a little bit different depending on what you're using. All right, we will go ahead and start recording. Welcome, everyone, to our first Lunch and Learn of fiscal year 2025. Those of us in the state are adapting to our new fiscal year, and Ashley is our first presenter. Many times when we work in the mental health world, we also collaborate with the Office of Vocational Rehabilitation, and they have had lots of changes, one of which being bringing on Ashley. So for those of you who are therapists, case managers, or peer support specialists, it's really important to know how VR can partner and how we can work together to help all those we serve thrive. So I'm going to let Ashley take it away, and I'm super excited to learn from her and her passion for this work. Thanks so much for being here today, Ashley.
Thank you. So like Michelle said, my name is Ashley, and I'll be asking a couple of questions of the audience, and you can do it through the Slido, or you can just voice that. That's all we have the QR code up here. But let's go ahead and get started. Well, I'm going to be the one with the technical difficulties so far. So I am the program administrator for the Deaf and Hard of Hearing Services branch under the Office of Vocational Rehabilitation. Oh. So how many of you have heard of the Office of Vocational Rehabilitation? Okay, we got a couple responses. Great. So I'm going to assume we've got a blank slate here. I can go over some background information, and so you're aware of what our office is about. So we're going to focus on my role as the program administrator and what I do for Deaf and Hard of Hearing Services, which I'll refer to as DHHS. And then I'm going to give a little overview of the Office of Vocational Rehabilitation, which I'll refer to as OVR. I'm going to kind of discuss the process and services for Voc Rehab, especially focusing on the deaf and hard of hearing branch. And I'm going to kind of review some of the misconceptions that we often hear and kind of explain what we can do and what we can't do. And then lastly, I'm going to discuss some of the changes for our office that we have seen this year and continue to work on. So just a little bit about me to start with. I began with the Office of Vocational Rehabilitation in 2015. I earned my master's from Kentucky University in sociology in 2015. Then during the pandemic, I thought, why not go back to school? And I earned my master's in rehabilitation counseling. And then I also earned my certified rehabilitation counselor certificate in 2020. So that was a big year for me. Everybody was staying at home. I decided to learn. My office is technically located in the Career Center in Hopkinsville, but I cover the hard of hearing and late deafened services across the state. And I started in this position in September 2015. Nope, September 2023. Sorry about that. And before I actually transitioned to this role, I was a counselor, a mentor, a communication specialist. I did a little bit of everything.
We'll have Kate here, which is perfect for me and for bars, Sydney Lee. So if we're getting dance tonight. So Simone, if you.
So, another question. What do you know or what have you heard about the Office of Vocational Rehabilitation? You can put this in the chat. You can use Slido. If you haven't heard anything, let me know that as well. So I often refer to vocational rehabilitation as the Kentucky's best kept secret. And a lot of people come to us and they're not sure what we offer or have never even heard of us. So not too many provided information. That's okay. Like I said, I'm going to give you a little bit of overview so that we're all on the same page and so you can get some information and hopefully help not only yourself, but your team and whoever you work with. So the Office of Vocational Rehabilitation, our mission is to empower Kentuckians with disabilities to maximize independence and economic security through competitive integrative employment. So that means we focus on re-entry into the workplace, on helping people maintain employment, advancing in their careers, assisting with independent living needs, and so much more. A broad overview of the OVR process. Typically, a consumer will call us or we will hear from a medical or mental health provider wanting to refer someone for our services. So we will get their information and we will schedule an appointment. At that appointment, the consumer will come in and meet with the counselor and complete an application. During that time, the counselor is going to ask a lot of questions to get a general idea of what the person may be struggling with, barriers, how their impairment is impacting them, how it's preventing them from finding work, or how it's affecting them in training or on their job site. Because the more information that our counselors gather, the more ability we're going to have to help with accommodations and services. So once someone applies for services, then we request medical records or we send consumers for assessments. So for example, if you're coming to us for a hearing assistive technology, we may send you for a hearing test and a hearing aid evaluation. So, because we want to know how severe your hearing loss is, if you're having difficulty with certain speech sounds, and what their recommendations are, the audiologist, as far as, do you need hearing aids? Do you need some other type of technology? Once we get all available information, we determine eligibility. In our eligibility process, we look at a few things. We want to know, does the person in fact have an impairment? Does that impairment impede employment in some way? Are our services needed to help this individual that's applying? Can they benefit in terms of employment? And does this person actually plan to pursue employment or maintain their employment? Once they're determined eligible, then we meet again and we create an individualized plan for employment. This is where we discuss all the services that we can provide. We write down what services we're going to offer, what services the consumer wants that's going to help them be successful. We put timelines on there, who's responsible for what vendors the consumer will be working with. It's an entire game plan, a guide for this entire process, how we're going to help the consumer accomplish their goals all the way to closure, which is hopefully successful. Right? Any questions so far about that? Like I said, a very broad overview. So some of the services that the Office of Vocational Rehabilitation offers is guidance and counseling. We want to help people get from point A to point B and all the steps in between. We offer transition services. Now, this can be from students transitioning into training or transitioning into employment. It can be people that are transitioning from workshops into competitive integrative employment. We offer rehabilitation and assistive technology services, job retention. So if you're struggling on the job site, we can, discuss different types of supports and technology and see what we can do to help you maintain that employment. We offer training assistance, whether that be vocational training, university training, on the job training, etc. We offer information and referral. We often partner with several different state agencies. So, for example, if you had someone that wanted to pursue a vocational career, I may refer them to someone who works with WIOA, so to see if there's any scholarships that are available for that vocation. So we work together with several different agencies and partners to help consumers to the best of our abilities. We offer support employment, which is where someone is partnered with a job coach to help them throughout the employment process and once they're hired. We also offer driver's rehabilitation, someone that's maybe had a significant neurological impairment and isn't sure if they can drive or not. We can assess them that way. And if they're determined that they can drive, we may have to do some type of modifications to their vehicle. All those are services that we offer. Again, this is just some of the services that we do. It would take me hours to go over everything. So, given that information of the Office of Vocational Rehabilitation, why do we need a deaf and hard of hearing services branch? What is the purpose? And why is that important? Well, hearing loss is on the rise in the United States. It's expected to be almost double by the year of 2060. Right now, our prevalence rate is 20.5% of the state has some type of hearing loss, which is higher than the national average. There's also a lot of research coming out that hearing loss is being associated with high rates of social isolation, loneliness, depression, anxiety. There's also been a significant link found between hearing loss and cognitive decline, like dementia. So, obviously, hearing loss, there's a lot of dominoes. We need to make sure that we are addressing the needs because more and more consumers have hearing loss and it's affecting them in their daily lives. So that's one of the reasons that the deaf and hard of hearing branch is so important. So, deaf and hard of hearing services. Our purpose is to enhance the lives of those that are deaf, hard of hearing, late deafened, and deafblind individuals by providing services which emphasize and advance employment outcomes that are unique to their needs and their choices. We're very big on engagement and informed choice. We want to help minimize and eliminate barriers as much as possible to help consumers that have some type of hearing loss be successful in their lives. So let's kind of talk about hard of hearing individuals versus latent deaf and et cetera, just to kind of give you a little bit of idea. So hard of hearing individuals, they have some degree of hearing loss, and that can be from mild to profound hearing loss. And when we measure hearing loss, it's measured into normal, mild, moderate, severe, profound. The onset for this type of hearing loss it varies. It can be any time throughout someone's life. And people that are hard of hearing typically benefit from hearing aids and other assistive listening devices, or ALDs, as that's the abbreviation I use there. The communication is often auditory, which means a person that is hard of hearing usually relies on speaking, listening, lip reading, things like that. Latent deafened individuals have severe to profound hearing loss. The onset for these individuals occurs sometime after the development of language and speech. So it can be in their teens all the way up to mid-age. This happens after they've been to school, they've learned speech sounds, something happens, whether it's disease, infection, etc., that leads to this latent deafness. Now, someone that is classified as late deafened requires more intensive support.
Actually, hold on just a second. We're having some interpreting issues. Chelsea, you're freezing a lot on our ends. We are going to switch to Alicia to try to figure out what's going on.
Okay.
Okay. All right, let's try it with Alicia and see how we go. All right.
Okay. So, latent deafened individuals, their onset occurs after the development of language and speech. These individuals typically require more intensive support, and it could be a combination of different services, whether that's hearing aids, assisted listening devices, cochlear implants, BAHAs, a wide range of services, strategies to help this individual. Their communication preferences may include ASL, finger spelling, texting, writing, etc. I will say latent deafened individuals are unique cases that I've gotten a chance to work with. I had one individual that came to me. He woke up one morning. He was a truck driver, and of course, he was sleeping in his truck for the night. He woke up and he had lost all of his hearing in his right ear. He had no trauma, he had no illness. He went to his primary care doctor, he went to an audiologist, he went to an ENT, he went to a neurologist, and none of them could figure out the reason why this person had lost their hearing in their right ear. And he still to this day does not have a definitive answer. And so it's cases like that that we classify as late deafened. So some examples of services that we offer for individuals that are classified as hard of hearing or late deafened. Assessment of technology needs. Maybe they need certain devices on their job site, like an amplified phone, a a microphone, something that can help them perform their job task. We do on-site work and task analysis. Again, we're trying to see what a person's job tasks are, what their barriers are, how we can minimize or eliminate those through services, supports, technology. We also train people how to use technology. We don't just purchase a microphone and say, here you go. We also we hire audiologists to provide that training as well. So if we have a special microphone or a certain smart device, a tablet, a phone, and we want a specific app or device connected to that, then we can pay for training with an audiologist, just to make sure that the consumer is aware of how to use their technological devices to the best of their abilities. We provide communication and coping skills training, a lot of communication strategies and tips to help not only the person with hearing loss, but their coworkers or their employer to have tips on how to interact so that communication barriers can be eliminated as much as possible. We provide educational training programs with supports such as note takers, interpreters, or assisted listening devices. And we also help with employment preparation activities. So like preparing for interviews. This is sometimes a very strong source of stress for people with hearing loss, especially if they know they're going to be interviewed by a panel, or if they're going to be interviewed in an area with a lot of background noise. So we try to help consumers prepare for that and to kind of ease that stress a little bit. Deaf individuals, now this is not my area expertise. Amanda Friend, who is the branch manager, she oversees deaf individuals and deaf services. But I did want to cover this just so that you guys are aware. Those that are deaf have severe to profound hearing loss. Onset occurs before or after the development of language and speech. Again, they typically require more intensive supports, whether it's a combination of hearing aids, assisted listening devices, cochlear implants, ASL interpreters, etc. Communication preferences vary. It can include American Sign Language, finger spelling, texting, writing. I just realized I had texting on there twice. Yay for proofreading. Emailing, Zoom, video phones, etc. So some examples of deaf services. Now we have rehabilitation counselors for the deaf that are specifically, their entire caseload is nothing but working with individuals who are deaf. And they know ASL, they're able to communicate in a variety of ways. And some of the services that they provide is information and counseling about different jobs, information and referral for other services, maybe support services or partners that we can bring in to help them accomplish their goals. Assessments about job, and I can't talk, assessment of job skills. See what sort of skills they have and how we can apply those skills to different types of career sectors. Interpreting services, interpreters only interpret for active OVR consumers. And typically they interpret a while on the job and then they slowly fade out. And then the employer is responsible for covering those interpretation services. training programs with support services to learn new job skills, technology and including training for work-related job placement assistance as well. So, as I said, we have specific counselors, rehabilitation counselors for the deaf that provide these services. Is Chelsea back on board? I didn't know if Alicia needed a break or not.
Chelsea's back. She doesn't have co-host privileges yet. So we could give this to her. And thanks, Ashley.
Yeah.
Working on it right now.
Okay. Are we good to go?
We're good. Go ahead.
Fantastic. So we really focus on the consumer's communication preferences as far as which type of counselor that they're going to be partnered with. So if a consumer's primary mode of communication might be speaking, listening, emailing, texting, then they are going to be assigned to a counselor who has completed communication training. If a consumer's primary mode of communication is going to be fingerspelling, haptics, ASL, then they are often assigned to a rehabilitation counselor for the deaf. Because we want to make sure that we are making the consumer comfortable and we're using the communication preference that they feel more comfortable with and that they use most often. So having given a brief overview of the Office of Vocational Rehabilitation and the Deaf and Hard of Hearing services within that branch, what do I do? Like I said, I was hired in this position September 2023, and this position had been vacant for several years. So, as the new program administrator for Deaf and Hard of Hearing services, I create and provide training to our OVR staff. I work on a lot of outreach activities. I think I'm up to 15 or 16 presentations since I was hired in September. I work on recruiting new vendors so that our consumers have a wide choice of people who they can choose to work with. I coordinate with manufacturers and vendors to get special rates on our hearing devices, our assisted listening devices. I create and revise forms. We have a DHHS email box, and I monitor that and try to answer all those emails. And that box is for counselors, vendors, potential consumers, anyone on this call. If you had a question, you can email this email site and I'll provide that, and I would respond quickly to any of your inquiries. We also have a communication teams channel for our counselors that I help run, and I do a lot of training through that for our staff. I do data and reports. Specifically, I look at, how many hearing aids have we purchased? How many cochlear implants? How many assistive technology devices? What areas do we need more vendors in? Which areas are really spending money on hearing aids versus which areas are very underserved and aren't spending money in any areas? So that's what I focus on, looking at the data, running the reports, and trying to identify trends. And again, I offer general support to all staff, concerns, problems. I also offer support to any consumers and potential consumers. I get phone calls all the time asking me, hey, I heard that you might be able to help me buy hearing aids. What do I do? What is the process here? And so those are questions that I answer and help get them to the right counselor to tackle their needs. As I said, our branch manager for the Deaf and Hard of Hearing services is Amanda Friend. She is the manager of all DHHS staff, which includes assistants, RCDs, which is the rehabilitation counselors for the deaf, and interpreters. She's also the state deaf coordinator for deaf services at the local, state, and national level. So she is an incredibly busy individual, and I'm sure some of you that have been around for a few years likely know about Amanda and had interactions with her. So any questions before I move on?
Ashley, it looks like you have two questions in your Slido.
Oh, All right. Does OVR help with work from home jobs for stay-at-home moms as well as, or only? We do help with work from home jobs. That is something that's become more popular since the pandemic. So that is something that we assist with. Um, we have DHS peers, therapists, and case managers on the call. As a trainer, what tips do you have for educating others on working with hard of hearing or late deafened individuals? I actually have several communication tip sheets that I've put together. Um, that I can get those sent to Michelle and she can disperse those. A big thing is making sure that you're maintaining eye contact, that you learn what their communication preference is, um, that you're acknowledge that you're going to make mistakes, and just be positive and patient and try your best to facilitate that communication. Um, I can get those tips out to you all.
Ashley, I think that was actually my question. This is Michelle.
Oh, okay.
We actually have folks on the call who are deaf or hard of hearing themselves
Hmm.
primarily. And so I think more is about the question of as a trainer, and from your trainer's perspective, what do you find is most successful in educating people who don't know about hearing loss?
When I tried to educate my staff, one of the things that I started doing was a hearing loss simulator, and it's through Starkey because I wanted my staff to realize, okay, it's hard to empathize with someone that has hearing loss if you don't have hearing loss. So the simulator, I'll do it, and it'll show what normal hearing loss or normal hearing level is supposed to sound like. Then it goes up to mild, moderate, severe, profound, and it's a shock. You can see how the sounds change significantly, but you can also see at the bottom the speech that's going across the screen, all the different sounds, and vowels and consonants that are slowly disappearing as the hearing loss becomes more severe. I will say that was incredibly impactful, and it really drove home how hearing loss is affecting people, and it really made our counselors empathize with their struggles. I will say that was kind of a big shock. And that's kind of how I started my training, especially our state training. And then I followed that up with different tips. When you're working with this population, make sure you're not talking as rapidly as I probably am right now. Don't have gum or anything in your mouth or in front of your face. So that I will say those simulators are a really big hit and really drive the point home. And I can always send those to you if you'd like that.
Thank you. Looks like there's two more questions in the Slido.
Does OER still offer job coaching? Do you mean in terms of support employment? Because we have job coaches through support employment, that actually help the consumers get jobs. And then once they have jobs, are helping them on the job site and they slowly fade away. And then I can't see any other. Did I answer everything?
There's one other question. What tips do you have for mental health professionals to have positive relationships with OVR when sharing cases?
Um, Make sure that you have all the releases signed. With HIPAA, we have to protect everybody's information. So sometimes it requires a combination of our releases plus your agency's releases. If you're making a referral, we found it very helpful if you have the consumer there in office so that we can all be on the same page and the consumer can have a voice and say, hey, moving forward, I would like my case manager or my counselor be involved in this process as well, since they are support for me. That's always a great idea. Also, you can encourage the consumer to sign releases when they come to do their application appointment and list your individual name on those releases. And that grants us permission to speak with you about a case, give you updates, kind of coordinate services. Okay. So I'm going to go ahead and move on. So for vocational rehabilitation, we've made a lot of changes this year. By the end of the year, all of our counselors will be trained to work communication cases. Previously, we had communication specialists, one in each office. They had specialized training. We've seen a significant increase in referrals and requests for services. I don't know if it's because of the pandemic and people struggling to hear because of masks or because we are offering more services. It could be a wide variety of things. But because we just had certain counselors that were trained in this area, appointments were getting scheduled farther and further and further out. And if you have someone that's in jeopardy of losing their job because of their hearing loss, that's a problem. So by the end of this year, every single one of our counselors will have communication training. I think we're up to 73% of our counselors being trained, and that's out of 140 counselors now. And when I say trained, I mean they know the different levels of hearing loss, speech recognition, how to read an audiogram, a wide range of different topics. And I provide training or tips every single week when I learn new information as far as new technology, etc. We have classified this as our learning year because we have revamped policy, we've got new vendor agreements, new service fee memos, a lot of different changes. We've increased a lot of our fees because we want to do more and reach more people. And we have a very large focus on increasing engagement and customer service. That's one of the reasons I've been doing so many presentations. We want to make sure that you're aware of our services so that Kentuckians can get the help that they need. So let's kind of talk about the truth about OVR. I've heard a wide range of things over the years, and someone that may have applied for services back in, 10 years ago would have a completely different experience compared to today. So let's just go over a few of these. Our services are not for everybody. We only work with those that have some type of limitation, barrier, or disability that may prevent or hinder employment. So that is our whole purpose, to help people with some type of limitations. And again, we focus on that employment piece, help them advance, maintain, re-enter the workforce, etc. Our services are based on eligibility, not entitlement. And I say that because you have to meet eligibility requirement. Do you have an impairment? Can you benefit from our services? Do you need our services? Can you benefit in terms of employment? All of our services are individualized, so not everyone receives the same services. So someone that has a cochlear implant that we've helped pay for and another person comes to us and they want a cochlear implant, they may not meet the criteria. So that's not something that we could move forward with. We focus on what the consumer needs, what their barriers are, what their abilities are, and what their vocational goals are, and the services that we can provide to help them be successful. And so that's why all of our services are individualized. There are more changes, as there are lots of changes. And again, that's why this is our learning year, as more laws and policies are enacted. One consistent thing about state government is that there's no consistency, but we try to be as transparent as possible. So all of our policies, all of our service fee memos, all of this can be accessed on our website. And that's kcc.ky.gov. Anyone can log on to there, click the Vocational Rehabilitation tab, and have all the access to information that staff do. Because we want to be as transparent as possible and we want to help consumers make informed choices. A person can apply for services at any time in their life. We do not deny an application for anybody. A person does not have to be receiving SSI or SSDI, any type of disability benefits, to work with us. That's not a requirement for OVR. Excuse me. Another thing, we don't help people apply for disability benefits. I know that's been a misconception in the past. However, we do provide benefits counseling for anyone that does receive disability benefits. So a lot of times people are worried about going to work and losing their benefits. We actually have them meet with a benefits counselor and explain, this is what's going to happen if you work this many hours. This is how you need to report your wages. All of that information. So again, the consumer can make an informed choice about how many hours they want to work, how much they want to earn, etc. We are consistently working on providing education about our services and resources through outreach. LVR is a partnership. Success is dependent on the consumer participation. I always explain this during the first meeting as a counselor. Um, you have to work together, the counselor, consumer. If we bring other people in, like our job placement specialist, a job coach, a case manager, without that partnership and everybody working towards a common goal, success is not always likely. Okay. We have federally mandated timelines that we have to meet. So, for example, we have to determine someone's eligibility within 60 days, and we have to develop an IPE or a plan for services within 90 days. That's the max time frame. It rarely ever takes that long. We have placed an emphasis on getting those done quicker so that we can provide services and move consumers through the vocational process and meet their needs as quickly as possible. All right, Chelsea, you still good? Okay. Our agency can only authorize for services from established vendors. And when I say vendors, I'm talking about support employment providers, audiologists, hearing instrument specialists, medical and mental health providers. We have a lot of vendors and we are constantly recruiting more. But that's how the state authorizes payment. They have to be an established vendor with us. And if you ever have someone that wants to be a vendor, they can reach out to me or anyone at any time and I'll help guide them through that process. We can start working with people as young as age 14. And we try to get these services in school. They're called PREETs, which is pre-employment transition services, and it focuses on building skills and tools that students will need as they transition through grade years and as they transition out of high school. We have policies and service fee memos that we're required to follow. Again, all of those are on our website so that you can look at those anytime, and so that you can be kept in the loop. We value transparency a lot. And again, our focus is consumer success. That's our number one every day. The whole reason we work for this agency, the whole reason our agency is here. We want to help people that have any type of limitations or barriers, disabilities, impairments with becoming successful and accomplishing their goals. All right, so questions. Who has questions for me or comments? General
Ashley,
concerns, all right. Yeah.
Ashley, this is Michelle. Maybe share and then we'll be able to see each other better.
I'm sorry, can you repeat that?
Could you stop your share screen and then that way
Sure.
we'll be able to see each other better?
Is that better?
This is Michelle. It's a good time to switch to gallery view if you'd like to see other faces.
Okay.
That
All
was
right.
a great overview. I'm wondering if anyone on the call has questions about the changes in Voc Rehab and the expectation now that all counselors will be able to provide some form of communication services or knowledge.
Yep, and it goes back to the consumer's preferences. If they have some type of hearing loss and their preference is primary auditory, then they're going to work with a communications counselor, which would be anyone in the offices that's had that kind of training. If they rely on finger spelling, ASL, haptics, then they're going to be specifically partnered with a rehabilitation counselor for the deaf. I will put in the chat the DHHS email box. You can email this anytime for general questions, referrals, concerns, anything. I monitor that all day long. And if it's a referral, then I get the information needed and I get them sent to the place they need to go. I try to answer all questions, concerns to the best of my abilities. And if it's not even hearing related, because I've gotten those too, then I try to get you in the right direction. Don't be shy on me now. Yes, Jules.
Hey there, this is Jill speaking. I'm a mental health therapist here in the Louisville area. And I do want to ask about your transition age youth, like your teens and above. What is the process like for getting them in school? What does that look like?
All of our schools are assigned a transition counselor. Now, saying that, some of the schools do not work with our agency. They rather provide the transition services themselves. If it is available in your school and your school district, then all they have to do is sign a permission form, and then we have counselors or transition staff that will actually work with them. So, what school district are you thinking specifically?
In the Shepherd, like Bullitt area.
I'm sorry, what?
And Bullitt.
This is Michelle, Bullitt County, Shepherdsville.
Okay. All right. So I will find out if that is one of the schools that we are able to work with, and I can get that information back with you. Or I can share that with Michelle, and she can share that out as well. We do have a contact that's over
Okay.
the transition services, and that's Veronica Dale, and I will provide her information to Michelle as well. She oversees all of the transition services.
Okay. Thank you for answering. I have the hard of hearing student in particular that I'm thinking of.
Okay.
So I'm thinking that perhaps I could use that service.
All right. Well, fantastic. I'll get you in touch with Veronica.
Okay, great.
I've got a hand up for Patricia.
Yeah, hi, my name is Patricia. I'm deaf and I've been a VR consumer for many years now. And I've always gotten great services from VR. But I'm just wondering, does VR partner with the peer support specialist, or is that typically like a separate agency and they don't collaborate together? How does that process work?
We have been working with Michelle and Brad Leedy to spread information more about Bridgehaven's peer supports. Is that the what you're speaking of?
Yes, that's exactly what
Okay.
I'm referencing.
So we actually had Brad do a presentation for our deaf and hard of hearing services, and then he's going to be doing a overview of services on my communications meeting with all of our communication counselors in August, so that that information continues to be dispersed. We've sent out emails, we posted it in our teams, but we wanted him to come to make sure that he's getting that information to all of our communication counselors and make sure that they understand it's not just for someone that's deaf, it's for anyone with any type of hearing loss. We know how isolating having hearing loss is, and we want to make sure that people are aware of the supports that there are. And thank you for your
Awesome. Thank you
positive
so much. You
experience.
answered my question. No problem.
Do we have any other questions?
Maria, did you have a question?
Okay.
Yes, I do. Hi, I'm Maria. I'm a former VR consumer. And I use them in high school and on into college. And my case is closed with VR. I've not been an active client in a number of years now. But, if I decided that I did need VR services, am I able to reapply or is that a one and done thing?
You can reapply at any time. You can reapply 15 times during your lifetime. There is no set limit. Anytime you need assistance, you can apply for services. And then if you're wondering who you should be
Okay,
connected
good.
with, You can always email the DHHS email box. I will get back with you as far as the information I need, and then I will get you in touch with the counselor that would you would be partnered with.
All right, great. Thank you so much.
I see a Michael with a hand up.
Hi, I'm Michael. I have a client that's a VR consumer, and they said that they were having an issue, I guess, getting some services from VR.
Okay.
They were hoping to be able to apply for school again, but VR wasn't providing that service to get them back in school. So I'm trying to figure out why they were denied that. Um, because I don't know if
Oh,
there was a reason or what it would be that, she wouldn't be able to get services for that in particular.
I don't know the specific case. I do know that we had brand new vendor agreements and we had tried to reach all of our vendors for several months and we explained come July 1st, if we don't have those vendor agreements, we cannot make any active authorizations. And so that affected a lot of our bigger areas, our bigger hospitals, our bigger schools, because they have to go through such a lengthy process to get those vendor agreements signed. And that may be the case. I don't know specifically. I can always, if you want to send me an email, I can reach out to the counselor and see what's going on. But that did tremendously impact us.
Okay.
And then Miss Patricia.
Sorry, me again. I want to ask another question. I'm just wondering, if there's a client that, isn't jiving with a particular VR counselor, is it possible for them to be reassigned to another counselor, even if it's out of their area of residence?
That's going to be a manager call, a branch manager call. Typically, we try to work through and work with the counselors, but sometimes people just do not mesh well. Um, so sometimes they've been reassigned. I know that's happened, but we try not to allow consumers to counselor shop, if that makes sense, because we've had that in the past too. So that is going to be a manager call of that area specifically.
Okay, I was just curious. Thanks.
All right, we've got about 2 more minutes left. Has anyone else got any questions or concerns?
This is Michelle. I just want to thank you so much for your time, Ashley, and for talking about the differences. I really especially like the 4 slides around what people think VR is versus what it is. I think that's really helpful. And even understanding bigger picture issues like vendor contracts. A lot of times we can't move in state government as quickly as we would like. And it's not under our control. And that can be really hard when we have to keep telling people no. Thank you to Chelsea and to Alicia for being amazing interpreters and for persisting through technical issues. And we are in dialogue with Ashley, with Amanda, with Voc Rehab. So this is definitely not an end. Just take this as a beginning of getting to know Ashley and her work, her getting to know you all as mental health professionals in Kentucky. And please reach out with folks. I will make sure that I pass along the PowerPoint that she used. And then when I get tip sheets and other information, I will pass those along to those of you who attended today as well. If you're watching on the recording, you can reach out to me at michelle.niehaus@ky.gov, and we can send you that same follow-up information. So thank you all for participating, and I hope you have an excellent rest of your day.
Thank you all so much.